Okay, so let's switch gears. And in a way, I think these potentially are related in terms of patient safety, but AI, such a
Okay.
huge topic. Um,
Yep.
in your experience thus far, and we're pretty early on, do you think, or have you seen that there is potentially an effective way that healthcare can integrate AI for language access? And any caveats about that, any experiences around that would be, we'd just love to hear it.
I have lots of feelings about AI, and they are polarized. I absolutely love AI, and I don't think we should be using AI at all. Like I feel both ways. So let me.
I do too. I get it.
Yeah. So the bottom line is, it kind of like when VRI came into the picture. Initially, language access said, absolutely not. We're not using VRI. It's not appropriate. And VRI is going to take all of our jobs, and we don't want that. So we're not using it. And then over time, especially after COVID, VRI became very accepted. And healthcare systems have done a much better job, I think, in general, of partnering with their IT department to make sure connectivity has been improved. My healthcare system, for example, we moved all of our VRI devices to an internal network that's specific to specifically for VRI. So those kind of things kind of help with bandwidth and the quality of the video, and that's huge. AI is similar to VRI in that people are like, oh my gosh, we should not, AI is going to take over our jobs. Even Microsoft did an article probably at least a year ago now, I'm guessing. Maybe not quite that long, but they did an article where they listed the top 40 jobs that were going to be impacted by AI, and interpretation and translation was at the top. It was number one. So AI is coming for our jobs, and it's not safe to use in healthcare, and we shouldn't be using it, period. That part of me feels that way. But the other part of me feels like AI is here. We need to learn how to harness it and use it properly. So that's really where I'm going. It's, AI is marketed as being faster and cheaper, and a lot of hopefully not a lot of healthcare systems, but people are thinking, well, it's good. Google Translate is good enough. People that don't know anything about language access will say, oh, great. Now I have, I'll just use Google Translate, or I'll use a dictation tool and translate something to another language that way. It's quicker than having to wait for the interpreter to show up. But that creates patient safety issues. There is an example, I don't know if you know Carla Fogren, but she is retired now, but was a leader in language access. And she uses an example back from COVID where AI was used to translate the vaccine is not required. And I think Google translated it to the vaccine is not necessary, which sounds like a minor tweak, but it's completely incorrect. So little tweaks like that can really cause a problem. When you use AI in healthcare, most healthcare organizations now have an AI governance council. And anytime AI is going to be used outside of language access with, say, your clinical teams, it really needs, any sort of AI tool needs to go through an AI governance council first. It also needs to be very limited in the scope, and it needs to be specific in how it's being used. And of course, needs to align with patient safety and civil rights requirements. So I think it's important for healthcare organizations to figure out where they're going to use AI, how they're going to harness this tool. It's definitely not something that I feel can replace humans. It's kind of like, we would never just replace our physicians with, or even medical assistants with AI. It just isn't possible. There are certain tasks, I think, where AI can make our jobs easier. For example, a lot of physicians now are using dictation tools, which is wonderful because they can focus more on the patient. they're not turned away from the patient typing on their computers anymore, because they can make that eye contact and really develop the rapport with the patient. So I think AI is really helpful in that respect. But to depend on AI for interpretation, we're just not there yet from a patient safety perspective. That said, if you're using AI within interpretation services, there's so many good uses for it. For example, AI can, if you have a translation department, AI can make the translator's job more efficient. It can translate chunks of information quickly, allowing them to go and proof it, and turnaround times can be shorter because of that. But ethics is another area where AI is just not ready to take over. There's too many decisions that are made as an interpreter that AI wouldn't be able to jump in and replace a human. A good example would be I'll give you two examples. One is, let's suppose I know a patient is on blood thinners and shouldn't be taking ibuprofen, and the physician says, I'm going to write you a prescription for ibuprofen. I, as the interpreter, knowing blood thinners, ibuprofen, allergies, whatever it is, I might say, I'm sorry, doctor, could you repeat what you're prescribing? Or I'm not sure I heard you right. There's a certain different things that I could do as an interpreter, different tactics that I might use as an interpreter to go, I'm not sure that was exactly what you wanted to say, without having to say it. AI is not going to do that. AI is just going to interpret, I'm prescribing you ibuprofen. Another thing is, a lot of our patients will do that. Yeah, sure, I understand when they really don't. And I, as an interpreter, I'm going to be able to assess that a little bit more, and ask for a restatement from the provider if I feel like the patient doesn't fully understand something. If there was patient harm, AI is not the one who's accountable. It's the provider or the healthcare system that's accountable. So when clinical teams rely on AI, like a translation tool, or like Google Translate, for example, or even Microsoft Azure or whatever, Google Translate, by the way, is not HIPAA compliant, but Microsoft Azure might be in your healthcare system. But using that, if there's an error, you can't say, well, AI told me that was correct. So that's another big reason why AI should only be used with human oversight. I did talk about ethical judgment. That's something that, only humans can do at this point. Maybe 10 years from now, that'll be different. But right now, same thing with situational awareness. Only a human can judge whether or not the patient really understands the message being communicated to them. So
reading the body language, right? Like,
exactly.
What is the statistic? 80% of communication is nonverbal, or something along that.
Exactly.
How do you replace that?
Right. You can't with AI at this point. Absolutely right. Yep. I'm sure somebody's working on it, but it's not there yet. And it would be, again, when you're traveling, when you're at a restaurant, when you're trying to communicate just in a fun social setting, I think AI is AI is the best. Use it, enjoy it. But when it comes to life or death situations, legal, medical, you don't want to hope that it's right.